So today we're going to be evaluating this 19-year-old African American male for sports participation. He's already completed his pre-participation screening with family history and personal history questions about cardiac disease. And so now we have to complete the physical portion of the exam, which is going to include pulse rate and regularity check, a chest wall examination, and an auscultation of the heart valve sites. So first, let's start with the pulse reading. I'm going to locate his carotid pulse right there. And then I'm going to start a timer for 15 seconds and count pulses for the full 15 seconds. Okay, so 15 pulses in 15 seconds makes 60 beats per minute. So that's perfectly normal for a person his age. And so next, I'll move on to the chest wall examination. So I'm just going to feel for any irregularities of the sternum, either protrusions or depressions. All feels normal. And then I'm also going to check the relative shape to make sure there's no barreling of the ribs. Feels normal proportion, so everything is normal there. And then finally, I'm going to listen to the 4 valve sites at the heart. Make sure my stethoscope is working. And then first I'm going to go to the aortic valve. Sounds normal. Now the pulmonic valve. Also sounds normal. Next is the tricuspid valve. It sounds like there might be some irregularity there, but I'll still move on and check the mitral valve. And that one sounds normal. But because of the slight sound that I heard on the tricuspid valve, I'd have to go ahead and refer this patient for further cardiac examination that can look for any type of valve malfunction, like a murmur would indicate. And at this time, we would not be able to clear this patient for full participation in sports activities. He would have to get a physician's exam with some kind of EKG or other heart image to make sure that there's no further issues. All right, so next, our patient is a 58-year-old male who has been sick with some type of cold or upper respiratory infection for the last 2 weeks. He's fully recovered now, but he's still complaining of some hearing loss in his right ear. So first, what we're going to do is examine your ears using this tool. I'm going to stick just a little bit of it into the opening of your outer ear so I can see down to the eardrum and make sure that the membrane is intact and that nothing is obstructing or inflamed around that eardrum, just to make sure that you don't have some type of active ear infection. And so I'm going to check both ears. I'm going to look in your left ear first, the good one, and we're going to compare it to the one you're having problems with. Okay. So I'm going to start out by lifting the auricle to line up the passageway of the ear, and then I'm looking toward the eardrum, kind of down to the 7 o'clock position for the cone of light, and everything looks normal here. I can see it well. Now let's look at the ear that's having some hearing loss. I'm going to do the same thing from the opposite angle. So lift back and away. Look into the outer ear passageway and down and to the right. At the 5 o'clock position, I should see that kind of light. But there is a little bit of fluid buildup and obstruction. Not so much that it looks very red and inflamed, but It might just be a little bit of leftover congestion from the upper respiratory infection. So my recommendation to this patient would be to continue with getting a lot of fluids and maybe consider some sinus decongestants over the counter to address some of those fluid buildup issues. And over time, that will probably help with the hearing loss. And it's just temporary. There's no damage to the eardrum or anything like that. So it should clear up in a matter of weeks. So our next patient is a 19-year-old softball player, and she was playing softball when she got hit with the ball. And then since then, she's been cleared for concussion and any type of skull fracture or anything like that. But she's still been having some vision problems in the right eye specifically. So what we're going to do is do an ophthalmoscope exam. Using this instrument, we can see to the back of the eye, the retina, and the capillary blood vessels and everything like that that supply the eye. And we just need to make sure that there's no type of bleeding or retinal separation that's compromising her vision right now. So what I'm going to do, I'm going to turn the light on the ophthalmoscope, and first I'm just going to check each eye for pupil reflex and red light reflex. So let's do that. Look straight ahead for me, please. Okay, so each pupil is reacting uniformly to the light and as well as dilating normally afterward. And now I'm going to look through the scope, and okay, in each eye I can see the red reflection of the retina back toward me. And so next I'm going to have you look straight out into the horizon, and I'm going to look around the surface of each retina just so I can make sure that there's no capillaries or blood vessels that have been broken by the hit and are bleeding right now. Okay, so I'll do that. First I'll look in the good eye, the left eye. Let's start there. And I'm adjusting the lens as I go closer so I can get a clear view. Okay, everything appears normal in that eye. So now let's check the eye that's been having some vision loss. Same thing, and I'll look with my right eye. Okay, so during my examination of the right eye, I can see where there's been some damage to a capillary vessel and it's actually burst. And so when you have hemorrhaging in the rear surface of the eye, some pooling of blood can occur, and it's usually very small, and usually it'll go away with time. But for now, it might cause a little bit of blurry vision or vision loss in certain spots. But normally, this type of thing is not an emergency, and it will clear up on its own given enough time. You might need some other medications to help just clear the kind of scar or the evidence of the blood away after it stops bleeding. But until then, we'll just keep track of it and make sure the vision loss does not get worse.